And welcome back to Ozarks Live. We have Dr. Charles Vogel from Dental ER. Good to see you again, as always.
Yeah.
We've been talking for a number of years.
Yeah, we have.
Now, let me ask you, how long has Dental ER been around?
Well, you've been around longer than it has, but
yeah, true.
But we've been together for about 10 years with you and the folks here at 10, and it's just been a great relationship. So we started back in 2009.
Mm-hmm. So you've been going strong.
Yeah.
And it's a little bit different the way you approach, dentistry, people coming in. What is the difference between what you do and, if I have to make an appointment at my dentist, just the regular way?
Well, it's just altogether different because we don't do appointments. We do just walk-ins. We have a few people that will call ahead, but we do primarily just walk-in care. It's an urgent problem. It's happened that day or the night before or something, and we get you right in.
Mm-hmm. Now, over the time that you've been, 10 years, how many people do you think you have helped in that time?
I was counting that up the other day. We've seen over 10,000 people in the 10 years.
Really?
Yeah, and those were people that didn't have other methods at that particular time. Some of them would have had to wait a while, yada, yada, different kinds of situations. And sometimes toothaches just don't wait, they just don't.
That is true. And you don't want to have to wait if you have a toothache.
No, you really don't.
That's the advantage of Dental ER.
Yeah.
All right. Now, how often do you say people should be going to their dentist?
Well, that's not for me to say. That's between them and their dentist. But, the thing is what you really need to know is at our place, it's just come when you need to be there. And typically, our costs only run $2 and a quarter, depends on the circumstance. Mm-hmm. Sometimes it's even less than $200. But when they get there, the huge advantage to our office versus some offices is, first of all, we take care of everything generally at that visit. There's no repeat visits.
Okay.
And the second thing is they don't have to wait to get in. They can just get right in.
Okay, but let me ask you this. You're saying you don't have to wait to get in. You don't have to make an appointment. How long do you like to spend with a patient? Because sometimes you feel, you go into almost any medical practice. Sometimes it's you're in, you're out, you're gone, and you hardly remember it. Mm-hmm. There's not time taken.
Well, we do things a little bit differently. We probably see 3 to 4 patients an hour, so I have usually about 15 minutes with every patient. But the point is that the patients are normally in and out in about an hour, and I'm there about 15 minutes.
All right.
So we spend some quality time with them, but our main goal is to get them in and out quick enough that they don't miss a lot of work, they don't lose pay, and they can go on and get the rest of the day accomplished without the pain.
Yeah, and the other thing is, you talk about it being an hour. You've got some great people who work for you there.
Yeah, we do.
Yeah,
we have some great people, and we have a couple of people there that have been there a number of years, and so that makes it a more friendly, easy to get along with environment.
Yeah, that's the first thing that you do notice. This isn't like prim and proper and, ramrod straight.
I'm dressed up.
Yeah, there you are, right there. I wanted to ask you, do you take dental insurance?
The answer is yes. We take all kinds of insurance, but we have people self-file it. And we do that to keep our costs down. If we participated in all of the programs, we would have to penalize our cash-only patient, and we don't want to do that. So we keep our costs down. We give you a universal form that's got all the information you need. All right. To send it in yourself.
People need more information quickly. How do they find you?
Just look me up. When you're in pain, you'll find me.
Dental ER.
Thanks.
Dr. Vogel, always good to see you.